Well, thank you to my colleagues there, Nompo and Nzing, of course, for holding down the fort on Point. It's a good afternoon to you and welcome to what is the third and the final hour then of the program. The numbers, of course, stacking up. Scary situation. Harrowing indeed, even a difficult path in that frame. Let's take a look at what the numbers look like now. According to the health minister, we're sitting at 1,380 people now having contracted the virus. Still 5 deaths in terms of confirmation. We have recoveries of around 50 people. So at least there is some good news in that regard. Just around 3% of people that have been tested for COVID-19 did contract the virus itself. So yes, it's not a lot, but we certainly want to decrease that as much as possible. Yesterday, of course, we did have renowned South African scientist Professor Gita Ramji as the big story there in terms of passing away, having suffered from COVID-19. Today, unfortunately, we do have another prominent person also contracting the virus. We certainly hope that they do not follow in the ways then of Dr. Ramji, unfortunately, who did contract the virus. But look at how quickly things can certainly turn if we take a look at how things continue to fare. We need to be careful, South Africa, as I keep saying. Take care of yourselves, please. Be aware, take extra caution where necessary. This is what the continued increases then look like as well then. Yes, we do feel like we're flattening the curve because the increases have gone from 93 to 46, 27 up, and yesterday again another 27 in terms of more cases. But the minister has said we may be reaching the calm before the storm. So that is the worry now. We did have those 67 now in terms of testing facilities, but hundreds of people are said to be tested soon with that 67 caseload. We're bound to see a change in these numbers, and we could even see them go higher, and we hope that it's not for the worst. As I said even yesterday, we do know how to fix or revive an economy. It may take some time, but we do know how to do that. What we don't know how to do is revive human beings and bring them back to life. That's according to Ghana's President Nana Akufo there as well. So no business is worth your life. Let's take a look at the global picture then. This is what we now look like. 951,900 cases of COVID-19 globally. It is an absolute pandemic. Nearly a million people, should I say, contracting the virus around the globe. The United States still sitting at number 1, more than 200,000 cases there. Deaths also just spiraling out of control, unfortunately, out in the United States, and it certainly isn't helping them at all. 13,155 deaths. When one takes a look at Italy, Spain also sitting above 10,000 in terms of deaths as well. 202,000 of that 951 have been able to recover, so it is a good ratio, sitting at just above 20%. It is an improvement from yesterday's data, as we said. South Africa does have less than double the cases, though, of its next country. Please, can we please take care of ourselves? Be serious. Look after yourselves now and always, and of course, even your families, and we'll look into the country as well. Let's take a look at your lead.